Welcome back to SUPERSTAT, the podcast where science meets stats and stories matter. I'm AA Odie.
I'm Melody.
Hi, I'm Stephanie.
And today we're diving into something that impacts everyone, even if you've never set foot in the lab or touched a test tube.
That's right. Today we're talking about access and laboratory medicine and why the future of healthcare depends on both.
Right, so let's break that down with the stat. According to the World Health Organization, millions of people globally lack access to essential diagnostics. That's not just an inconvenience, it's a life or death problem. Delayed or incorrect diagnosis means delayed or incorrect treatment.
And closer to home, even in high-income countries, cost, location, and awareness can all be barriers.
Right. So what are we waiting for? Let's get into it.
Now, here's where things get real, because access to quality lab testing isn't equal. Gotta be real about that. In rural areas, in under-resourced communities, and in even some parts of the world, reliable lab testing, sadly, is a luxury and not guaranteed.
Yeah, I think we need to start by really discussing the how and how we fix access gaps and the how of where the laboratories can truly be involved in creating innovative solutions.
Agreed. I mean, I think we start with infrastructure. That means better labs, right? Especially in rural and underserved areas, which I know is easier said than done because there's a resourcing situation there.
No, definitely agree with that. Even when I do accreditation inspections and go into some of the smaller labs, they're wanting that more space. So they're even like, please cite me for the space. Hopefully this will be what I need to get that additional space or so I can actually put the right equipment in.
Mm-hmm.
So that's it. Just the physical space can be an issue.
Mm-hmm.
Yeah, I think that's true. I've heard that as well. Like, please cite me on space. I've asked that before. Could you please cite me on space? And then really just when we talk about better labs, like I think that term is hard because when you may not have the access to the same like staffing applicants, depending on where you are. I used to work in like informatics implementations in rural communities. And one of the things that we always ran into is like, they'd ask us if we wanted a job and if we wanted to move there because they just they had like one MLS position open for a year and no applicants, which is just crazy.
Mm-hmm.
No, it's definitely tough. The people infrastructure we're constantly dealing with. We're down 3 people on nights. We have second shift openings. We've got day shift openings, more people retiring. So yeah, that's one thing people I guess don't think about is that the infrastructure does include the people and the culture and everything around it. And
yeah, you're talking about education and training, right? Lab pros don't grow on trees.
still a little bit. Yeah, I was going to get into that a little bit, but
yeah.
we're still talking infrastructure and having those better labs, and even the fact that we are seeing more labs shut down, the physical lab structures, and so now we're getting things sent out to reference labs where they have that access to more equipment and to more testing, and so we're even losing just the basic testing in those the actual physical places that do the testing that are right in your neighborhood. Now it's being shipped off to one of those giant reference labs. So
yeah, that kind of creates a continued concern for that workforce pipeline though, right?
Mm-hmm.
And so when you have all of your work going to a reference laboratory and we're no longer supporting our smaller rural laboratories, then that impacts the programs that are locally in those areas because those people don't really have those local jobs and you don't have that personalized medicine that's in your community. Mm-hmm. If you missed our episode on community, you can go back and listen to that. But all of these things are really intertwined, right? We need our high schools, we need our community college, we need our outreach programs to all be supported in one big, huge ecosystem.
Yeah, and I'm going to add on top of that too, when we're not just talking about like people performing the test on the bench, like when I think about education and training and access for better labs in these communities, I think about like the availability of like PhDs and doctoral personnel who really understand laboratory medicine. And if you're in like a city center, you might have that. But if you're in like a rural access, you may only see somebody quarterly, right? And so like, is that enough? No. Or you might have an MD who's trying, right, to like oversee, but doesn't have the lab background that they need necessarily to make some of these more critical like validation questions and those types of things more relevant to their personal lab. So I think it's bigger than just MLSs, but that is a big part of it too, because you have to have people doing the testing every day.
And that's not even just in the US, globally. I mean, we're talking about low income and rural areas in the US, but there's also low income countries that have to do remote training and have partnerships and global organizations to try to build that local lab capacity. And how is that also impacted?
Yeah,
that's true. And there's through a lot of more global programs too, for a lot of people that are in different countries, just those additional classes and certifications that are available that are in a lot of the current climate are starting to disappear a little bit, are critical things for them, for helping keep their labs updated, for being aware of what's coming down the pipeline.
What about policy change? I'm talking about insurance coverage, major insurance funding, public funding, global partnerships, how all that plays a role in access also. What are your thoughts?
I mean, I think Stephanie, you and I have done like the value-based training, right, and education. And I think we do have to start shifting our mindset and figure out our identity as a lab over the next 25 years. I think, if you're listening to this podcast and you're thinking about lab cares, you're thinking about that already. But there is a contingency situation, I think, where if we choose to stay the same, we have to think about what that means for us. And if we're going to pivot and really start championing like why we matter and where we fit and why policy has to change, we have to understand where that's going to. We can't just champion for it, not have a plan. And I worry about that a little bit sometimes because I don't know that the laboratory community as a whole has really spent a lot of time thinking about like, what does that mean for us? And how do we define that? And how do we reshape ourselves and our mindsets,
Or how do we even partner with our public health laboratory friends? And how can we better fund and integrate public health laboratories so that we can have these access points that we talked about? And I love what you just said about lab cares, but if you're listening to this and you're not involved in any professional society, so you can help play a part in the larger role of diagnostic equality and creating policies around that, then we highly encourage you to join a team. If it's not our team, a team.
Somebody's team. You gotta get off that bench somewhere.
You touched on insurance coverage and policies, and even with access there, that depending on what insurance is taken for that hospital or that lab, we've got cases where your insurance isn't taken by the lab that's right down the road, so it has to go to a reference lab because that's where insurance will pay for things. So then you have your testing going somewhere else, taking even longer instead of just in your local community. So that's, for me, definitely an access thing. And then I love that you mentioned public health, because a lot of the outbreaks and the awareness that we have about what's going on with, if there's an outbreak at restaurants or the surveillance work that's done by our public health groups, you're not aware of, because luckily we're not going through an outbreak because of the surveillance they're doing. And I think people lose track of that, but it's that access to funding and that access to knowledge from our public health people that until we had a global pandemic, people were like, oh, okay, yeah, they just tell me there's salmonella there, but there's so much more they're doing.
Yeah, I agree with you there. I also think when we talk about these types of situations, we have to think about global doesn't just mean international. It can mean that, but it can also mean like looking at where you are in a higher point of view, like a 30,000 foot view. I'm thinking specific population related. And then I would add on to that when we talk about access to diagnostics and delays and like resulting in those types of things, we have the situation with insurance companies. And I think it does need to be called out that you can have a test that's definitely needed. Like, for example, a biomarker Alzheimer's test is now starting to be a replacement for PET. And if that's really going to be the thing, PETs are really expensive, but your insurance is going to cover your PET but not cover the biomarker. That doesn't make sense. You know what I mean? Like, how do we help move forward in an evidence-based way when we have policy change? I think is also something we have to consider as well.
Yeah, that's a great point. How can we advocate for insurance coverage changes that improve diagnostic testing? You know, maybe there's an argument to be made for covering screenings without copays and things like that. So it's just time for laboratories to join that conversation.
Yeah. And I feel bad. I should not breeze over education. It's very important. I was like, wait, we're all lab educators. Let's skip over that about access to actually lab education, and even having the faculty access to faculty members that have the training and supporting that is a huge thing. And in my own practice, one of the places I adjunct teach at is in a rural area in Florida. So two of us are driving down from Jacksonville to actually do some of these workshops for lab, but providing that access, because it's hard to get lab professionals to teach in larger areas, but getting them into these rural areas is kind of tough. And luckily, there are some great programs. Like University of Arkansas has their MLT to MLS bridge programs, so providing that access to rural areas, but just getting those professionals there to teach students, and then once you've taught the lab professionals, keeping them there as well. I've gone to trainings with people that have said, I'm in a rural area and people just don't want to stay. Mm-hmm. So even if you can get them to training, it's just keeping them there as well. Yeah,
and unfortunately, if you're living where we live or in the country we live in, the problem is only going to deepen. It's not just the awareness of our profession or geographic limitations like Erin mentioned, but now it may also be the cost of education, and can people afford to go and become a degreed professional? And so these are definitely conversations that we can't stick our head in the sand about. We need to join them and have these tough talks and find solutions.
Right. So again, I want to point out, if you don't know, only 47% of the global population has access to basic diagnostic testing. That's less than half of us across the globe. And so if that shocks you, good. We hope it sparks some action. It shocked me when I read it the first time, for sure.
And if it doesn't shock you, this should. Bridging this diagnosis gap can prevent 1.1 million premature deaths per year. That's when we look at things like diabetes, high blood pressure, or hypertension, HIV, TB, hepatitis B, syphilis, in lower to middle income countries.
Yep, and in the U.S., access isn't just for those of us in traditional communities. So consider the individuals experiencing homelessness. You hear about all sorts of outbreaks there, and access to care in those communities. They're less likely to receive the routine testing that is going to be more preventative, and those diagnoses are being delayed. So for homeless individuals, there's even, especially in the LGBTQ community, they're 15 more times likely to delay HIV testing and access, and in different communities as well, just the stigma around HIV can prevent testing, which is crucial.
Yeah, STDs are a great focal point for this conversation, honestly, because when we look, I love that you brought up people who are experiencing homelessness, because in women specifically, STD rates are alarmingly high, like 60% test positive for at least one STD. And HIV infection rates in women are higher, 3 times higher than the general female population within that group. So it's like when we're talking about access, we have to look at the whole of it, And
getting back to touching back on public health, because you made a good point. The state of Florida and different groups are actually focusing in on areas that have higher prevalence of HIV. So it's that public health element we have to fund, where it's bringing testing and awareness and then closing the loop with treatment, but it's in some of those groups that they're focusing on.
Yeah, that's a great example. And so it's really just in your communities. Again, if you missed that episode, go back. Um, how can we tailor our solutions to fit the different populations that we serve rather than a one size fits all approach for laboratory medicine? So there are a lot of case studies and stories about mobile clinics in action, those helping with STD screening and unhoused populations and diabetes testing vans and a lot of different solutions that we should look at.
Yeah, and I think this is where you come in. Wouldn't you say, Aaron?
I would say so. I mean, access to best laboratory testing should just be a basic human right.
Yep.
It shouldn't be something that's a luxury. You should have the diagnostic care that can kind of lead you through a progression in your life to make the best life choices that kind of support you. So we need awareness. People need to understand lab medicine isn't extra. Like you're like, oh, you can just go pick up a new pair of fancy shoes or something. It's essential.
Yeah, it's just not this add-on thing, right, that you can take or not take. You need it for your health. And I think that's just really important. So I love that you highlighted that. Okay, well, that's our time for today. Thank you all for tuning into SUPERSTAT. If you learned something new, share this episode, leave us a review, and tell us something about the access power of lab medicine where you are. Until next time, stay curious, stay informed, and stay super. Bye.